Hello, and welcome to another edition of the SEANC View podcast. I'm Jonathan Owens, along with Artis Watkins, Suzanne Beasley, and Samantha Klein. The members are restless.
Yes, they are.
And we have lots to talk about. Coming off of last week's great podcast with State Treasurer Brad Briner and Thomas Friedman from the State Health Plan. Still lots of questions to answer, so let's get to it. Lots of questions still remain about the State Health Plan's new tier system. We posted stories this week about that. There seems to be a PR push from the hospitals that are not part of the preferred or access plans or tiers. And so...
got everybody lit up.
Yeah, the one Facebook post, I think it had about 200 comments. Several comments from the same person and several more from another person. So people were very interested in this topic, and I think we still have some questions to answer. Not that we didn't do a good job of it last week, because we did have the people in charge last week. So, but let's just try to kind of go through a few questions that we got.
Because it's complicated. There's no way to do this simply, because there's no way to do what we need to do, which is what Falwell wanted to do, which is say, here's a ceiling. This is the most we'll pay anybody, period. You can't do that. The legislature clearly said, they said, no way. That's, it's being mean to the hospitals. We don't want to do it. Mm-hmm. So Treasurer Briner was left only with the ability to do something a little more complicated, but it was that or some pretty dire circumstances.
Yeah.
If he didn't do anything.
And right out the gate, because, there were some comments about advocacy on behalf of state health plan members, but I'm not sure everyone realizes what a huge lobby the hospitals have and how much money they have to, try to keep things from happening that hurt their bottom line, so to speak. Not that they're hurting.
Yeah, and I think that people expected us to, oppose this vehemently. I'm not saying that we don't oppose parts of it, but this is what we've been pushing for 15 years, right? I mean, some form of...
Yeah, to stop getting ripped off by hospitals has definitely been a huge part. It has had to be a huge part of the agenda. The bottom line is we cannot get transparency. We can't know. Uh-huh. No one outside of the health plan and those hospitals, individual hospitals, and the third-party administrator can know what the agreement is between the third-party administrator that the state health plan hires and the hospitals. What we do know is we're paying them a range. And at one point in time, that range was anywhere from 80% of Medicare as a reference for reimbursement, all the way up to more than 800% of Medicare. We also know hospitals can operate efficiently and safely and make a profit at somewhere around 200.
Mm-hmm. And I guess we've always said that we're tired of them making a profit on our backs and counting on the state health plan to pay more to take up.
They've been wildly open over the years in state health plan board meetings going way back that the state health plan, if it paid less to providers, that would be a tragic thing across the hospital systems, because that's subsidizing the care of people who are not state employees and retirees. Y'all, if you're a state employee or retiree and your state health plan is overpaying hospitals to subsidize the care of other people, understand that means there's less money available for raises or COLAs. And there's more money coming out of your pocket than needs to come out of your pocket.
That means more in cost for you.
Right. You're paying more for other people. Period.
And we oppose that.
Yeah, very much.
We oppose that. However, you have to get to a place where that's not happening, and that includes transparency.
And we're not going to get the transparency. There is a law in place that says it's a trade secret exception to the Public Records Act to know what these hospitals are getting paid exactly. So we can't get that. Can't have it.
Yeah, one comment that I sent to you was someone said they have to report as part
they're
of CMS.
Thinking about,
But they're reporting just standard prices, and they're not reporting what is contracted with the state.
Correct.
Plan. And that's probably higher, right? Much higher.
Well, and you can call a hospital and say, how much is a colonoscopy at your hospital? But You could call every hospital you want to and find that out. You don't necessarily know all the admin fees and everything else that you're going to get hit with. And the third-party administrator negotiates all that mess.
Yeah, this is it's never just black and white.
Never.
It's not black and
And that's on purpose, right?
I mean, well, I'm certain.
Yeah.
Well, and people love their hospitals.
Yeah.
Because hospitals are where we give birth to our babies. It is where we see loved ones get saved, their lives saved, or get treated and their pain and suffering alleviated because they've been treated when they need it. So, of course, we love hospitals, but we don't love hospitals in terms of the business of hospitals.
Yeah.
We love the doctors and nurses working in that building and the janitorial staff and everyone else that functions to be a part of us getting better. But what you're paying is not for those doctors and nurses. That's not who's getting rich out of it. In fact, in most cases, they're woefully underpaid.
Yeah.
What you're paying for is what we call the C-suite, CEO, CFO, COO. There are such deep layers of administration in hospitals in 2026 compared to what there was a decade ago, certainly 2 decades ago.
Yeah, I thought Treasurer Briner had a point that I had not really ever heard before, but he said that they're considered nonprofit, but only because they are supposed to give away like charity care, right? It's not the same nonprofit thing that we think of.
Right. Yeah, people think it really means they're not.
So like people hear, oh, my hospital's nonprofit, they're not getting rich. Like, what are you talking about? This is not true, but it's
your
not
hospitals,
the same thing.
Definitely. Not now, some tiny hospitals are barely getting by. They're not getting rich. They're not throwing insane money at individuals. But the 2 hospitals right now, let's just take the ones that are yelling the loudest.
Yeah, I was going to get to that.
Yeah, go ahead.
No,
I'm going to shove you into it if it's okay.
No, I was just going to say that the big PR push this week was to kind of paint Atrium and WakeMed as the victims here. Would that be what you would suggest? Yeah, so what did you think of the they came out the gate saying we had no idea this was happening and we had no input, and that the treasurer's people obviously had a timeline. They came with some receipts. So they
come on. Yeah. I mean, Treasurer Briner's not going to come with receipts. If anybody knows him at all,
Not going to not come with.
And again, as we say often, no one gives the health plan more grief than SEANC. I mean, because we are so mad. We wouldn't even have to have a premium for state employees if years ago somebody had the courage to stand up to what Dale Falwell used to call the cartel.
Yeah, the cartel.
I don't know if cartel's the best example, but I see why he said it.
Yeah.
Right? Because what happened was, for years, hospitals just acted like, you can't touch it. I mean, okay, you want to pay us less than what you're paying us? We won't see your people. So if they're so concerned about patients, what? Let's talk about what Atrium and WakeMed have.
Yeah.
Atrium, well, first let me say, the amount of reserves that the state of North Carolina has for hurricanes, any other disaster across 100 counties, is $4.2 billion. That's what the state has. Atrium, by itself, has $10 billion in reserves.
Billion with a
billion.
B.
And that's just one hospital. They are the biggest.
Correct.
And their CEO makes, $26 million a year?
Right.
Yeah.
And apparently there's quite a few people in the C-suite making multi-millions.
And they want the state health plan to subsidize care for other people in the state.
I mean, you can be left with no other conclusion I don't know what they want. Here's the deal. They would not give a rate, apparently. I mean, if they're not a preferred provider, it means they didn't bid with a rate that's anything other than way too much.
Yeah.
So.
And this hasn't been a secret that the state health plan, was working on the tiered system. I mean, that's been publicly discussed.
So the timeline, John.
The trustees meeting.
Might be a good time to throw that timeline out. When did Atrium know? Because if you live in the area, and by the way, I can understand if I lived in an area where Atrium was pretty much everything.
Yeah.
I would be freaking out right now.
That's the part
that is a lot of our questions.
Yeah, and let's get to that in a second. I'll go over. Okay. So the timeline: the state health plan met with Atrium in March of 2025 to explain this whole program. So that's more than a year ago. They met with all area hospitals in August and September about Lantern. Thomas Friedman met with Atrium specifically on November 11th, 2025. Lantern contracts were awarded in March of 2026. The State Health Plan Board of Trustees approved preferred structure on March 17th, 2026. Treasurer Brad Briner met with Atrium CFO and CEO in May and June of 2026. And Treasurer Briner even said at the State Health Plan Board of Trustees meeting on June 5th, the meeting before the one
Before the
where
vote,
this one
yeah.
was announced, that nothing is finalized. So they had a chance to continue to negotiate.
So many chances.
The treasurer's office posted that publicly.
Yeah.
Atrium, I've not seen it anywhere where they have publicly taken issue, said any of that was false. By the way, this is, if anybody from Atrium's listening, come on the podcast. If the treasurer's office is lying, please come on here and let's talk about it.
Or WakeMed, too. I mean,
yeah,
they're right here. So.
We hadn't even gotten to them.
Yeah.
But they're about to be.
They're the same thing.
Yeah, one and
about
the same,
to be one and the same, right?
Now, getting back to the point about rural hospitals, we did have a lot of comments about counties where there weren't any preferred or access providers. And that even showed up at our board meeting this weekend when Thomas Friedman came and gave a presentation about this plan.
Right.
Some of the board members had some heartburn about that. And I think we are very concerned about those situations. There are a few counties where there are only non-preferred. I think Thomas Friedman had said they are working on some possible solutions in those areas, but nothing is finalized.
Well, and something to keep in mind, too, if you have an emergency and you're in one of those areas, your care would be treated under the access tier. So don't not go to your hospital and go driving an hour away or 2 hours away to another hospital. Go to your hospital because your emergency care will be treated as an access provider.
Because let's remember, what preferred doesn't mean you get charged a fortune if the provider's not preferred. It means you pay the same as you're paying now.
Yeah.
Yeah.
Preferred means you save thousands of dollars if you need some procedures. So to be preferred, you'd have to offer not just good price, but Thomas was saying a certain level of quality as determined by national accreditation organizations that look into quality in terms of safety and outcomes and things like that, aftercare. So there are some rural areas where there's going to be access.
Yeah.
And so you'll pay the same. But, either the hospitals are going to have to step up their game in those rural areas in terms of outcomes and quality, or offer a better price or a mix. And there's no way for us to know the exact situation because, again, we don't have transparency of the pricing. So all we know is some mixture of quality and cost went into this.
Yeah, I think it's important for us as an organization to establish some concrete foundational facts about the program. Number one, if you have an emergency, you need to go to the doctor closest to you, and you will not be charged anymore for that. I mean, the tier system doesn't matter at that point, right?
Right.
Access and preferred providers make up, I think, did he say like 90% of the hospitals in the state?
Yeah.
Providers, 90% of the providers, that includes the doctors.
And so those levels roughly are equivalent to or cheaper than what you're paying now.
Right.
So 90% of the hospitals in the state are around what you're paying right now. And, like we said, there are some parts that even we disagree with or we're working to alleviate some strain on our members. But overall, I think a big thing to point out is that if this tier structure hadn't been put in place, premiums would have gone up. I think the estimate was 21%.
Yeah.
As opposed to 5%, which it did go.
Yeah.
So,
and just a reminder about the premium increase: it is not 5% of your salary; it is 5% of whatever you were paying in a premium already. So we still don't like that it had to go up on you, but don't misunderstand and think that that's 5% of your salary because, wow, what a hit that would be.
So it would have been 4 times larger for everybody on the plan if this tier structure
and not just premium increases. The out-of-pocket costs.
Yeah, the benefits would have been eroded too. Yeah. So,
and then that would mean also less money for raises because it also would have required more money out of the General Assembly. So raises, COLAs, things like that, the money evaporate. I mean, I saw some people commenting on our social media that, the General Assembly could just appropriate more money. I mean, if they were willing to appropriate more money towards your benefits and your pay, they would do it.
Yeah.
I mean, but mind you, the General Assembly's appropriated a ton of money towards your health plan. And in this past year, we talked about it a few episodes ago. Treasurer Briner was thanking the General Assembly because they made an enormous contribution towards your health plan.
Yeah.
And our response at the time, this is before the tiered stuff even came out, was there's no way we're going to thank them for that because they don't need to be putting that much money into the health plan because all they're doing is subsidizing non-state employee, non-state retiree health care with money that could go into your pocket through your pay or your COLA.
Yeah.
And that's crazy. And then acting like we should be super thankful. The money that's going into that health plan wasn't doing anything to keep your costs reasonable. In fact, your health plan was on a death spiral.
Yeah.
Yeah. Still it's still in danger, right?
Still in danger.
Yeah.
But
I don't think that hits home with
they don't
the
know
plan either. You don't, that, I mean, you could potentially not have a state health plan at all if it just spins out, and then
maybe
I don't know. It's
maybe
happened.
at that point the state just gives you money and makes you buy
Exactly.
a terrible plan on the marketplace.
We
right?
fought that
Suzanne-
back a long
Yeah.
time ago.
Suzanne and I have had, as far back ago as when Democrats were in charge, they were saying, look, this is getting so expensive on us
Yeah.
that maybe we'll just give y'all a stipend.
Yeah.
And
then-
you go find your own health care.
Yeah. Try to do that today
Right.
Yeah.
because that stipend would not be.
Yeah. If you're 25 in perfect health,
Yeah.
you'd be okay for a little bit of time.
Yeah. I mean, obviously
have
this
a family or something, but
obviously this, is just a symptom of a much broader problem with our healthcare system. You know, obviously there are lots of problems.
we're the only industrialized country where it's like this, and North Carolina is the most expensive in this country. This is nuts.
Yeah.
It is nuts.
But again, I get it. If I lived in an area where it was just Atrium everywhere and nothing else, I kind of wouldn't care how nuts it is. I would just want to know.
You want to be able to go to your
Right. I want to
provider.
stay with my providers. Your provider can easily fix it.
Mm-hmm.
Your provider, like we said, has $10 billion in reserves.
Your
savings.
hospital, not your
So
not
your
doctor,
hospital.
right?
Well, they probably own most of the doctors, I would assume.
Yeah.
Atrium probably owns most of it. But the CEO of that hospital makes $12,500 every hour.
An
Wow.
hour.
So the average state employee before lunch on any given day, the CEO of Atrium has made more money than the average state employee would make in a year. No, wait, my math is wrong. It'd be after lunch, shortly after
Maybe
lunch.
little
like
bit.
2 or 3.
But it wouldn't be a complete work day.
No, wouldn't be a
Yeah.
complete work day.
It would not be a complete
And he
work
doesn't
day.
hit any home runs or score any touchdowns. I
Mm-mm.
don't understand how he gets this much.
Yeah, exactly. He's not a coach. But yeah, so if you wonder why this is the state health plan, I saw people thinking that Thomas Friedman, who runs the state health plan, people wanted to know his salary.
Yeah.
Okay, well, first of all, look it up because guess what? All public employee salaries, yours as a state employees and Thomas Friedman's as a state
Yep.
employees are online. Look it up and then compare it to the $12,500 an hour that the CEO of Atrium makes. Thomas Friedman's not y'all's problem, y'all.
And people were even saying we're getting paid by the state health
I know,
plan, which
I
was
know.
my favorite response because I was like, trust me, the state
We're
health plan
not.
doesn't have the
Right.
money to pay us. But the hospitals do.
John's kind of like putting it out there that, hey, if they had the money.
Yeah, I mean, but the hospitals do have enough to pay us off, right? So
Yeah.
maybe
Yeah.
maybe we change all
John
of it.
is losing his mind. Last week, he came out and said we had, what was it, the most interactive Facebook page in all
I
the
don't
state
think after this week, there's no way that's in dispute.
Agree.
Oh my gosh.
Agree.
Yeah.
Yeah, let's look.
But no, we're not open to any bribes. That's what allows us to sit here and say the truth.
Yes.
Yeah, I think people are caught off guard by our stance sometimes because, we are telling the truth, just the facts that we're not blue or red, and a lot of the comments that I saw was, this is the Republicans' fault, throw them out,
Yeah.
or this is the Democrats' fault,
Mhm.
Josh Stein.
Yep.
And we're here trying to tell you our position and, the facts as we see them.
The
Yeah.
bottom line, the truth, nationally and in North Carolina, there is bipartisan support for allowing that powerful lobby of big healthcare to keep charging us extraordinary amounts compared to any other country in the world. And no, our health outcomes aren't better.
Yeah, and this is not a blue or red issue.
It's a hospital issue.
Yeah.
It's a big money issue.
And we're not getting paid anymore by anyone to make these statements, and we're not beholden to any party.
But what our members do expect us to do is call it out. Yeah, fight for them. And this is the only way to fight for you right now, is to continue to say somebody has to pop the bubble the hospitals have been living in, which is, we'll just say no.
And I think that's why we've been maybe a little bit more on the side of the health plan, because they are finally doing something, it seems like to us. And, we can give credit where it's due.
It took an extraordinary amount of work also, y'all, to figure out how to have a system. And the people who are mad in many cases, it seemed, are the ones that are in access tier. So they're getting the same benefit. They're just not getting a better one. Yelling at the health plan, though, if it worked, I would tell you to yell at the health plan.
Yeah.
But for us to still have a health plan, and trust and believe, it's just as easy for the General Assembly just to tell all of y'all they're going to put a couple $100 more in your check every month and you go handle it yourself.
And that will not cover the premium for any plan.
Nowhere near.
But that's, if the health plan were to go bankrupt.
Which has happened in other states too.
And when people have said on our social media, then just pay them all the exact same thing. Hey, we tried that. Again, we said it earlier, but Dale Falwell, when he was treasurer, said, that's what we'll do. We'll pay every one of them $200, I think he said 20 or 50%, which would have been enough to operate safely and efficiently and make a pretty good profit. And they squalled. Mm-hmm. The hospital squalled like they were going to go bankrupt.
Yeah.
So there's so much more to advocating and fighting for this issue. And we can't be at war with the state health plan and expect to have any conversation with them, share information, and,
Yeah, and I think in this case, there are some things, like I said, that we do have some issues with. But overall, there's nothing to go to war with the state health plan over.
And you want us to
it's
have
more
an
the
open
hospitals,
door.
right?
You want us to have
we
an
should
open relationship
probably be
with
specific about what we have issues with. It's just the fact that, and the premiums are only going up like $2 to $8 per month, depending on what you make. We have issues with the fact that it goes up at all because we feel like hospitals should have to eat more of that, because by eating that just means less outrageous profit. It doesn't mean they're having to cut people or something. And then the second thing is the tiered system, where if you make over $65,000, you're paying so much more. That is just, we're getting into so much of punishing state employees who are at what is the average salary in North Carolina.
Yeah.
And acting like they're rich if they make average. I think that's a bad message simply because it makes it seem like state employees should be paid that much less than the private sector. So,
and we have some issues with the rural hospitals not being, or the access in rural areas. So.
But I think that pressure has to come from the people in those areas to their hospital. Why are you not in it? Why are you not in the plan?
Yeah.
And when the hospitals they're clearly telling people, we didn't know. So in some cases, they're saying we didn't even know, which is obviously untrue based on the timeline the treasurer's office put out. But let's say they didn't know. Okay, let's just take their word for it. They did not know they were going to be not preferred. When it was announced, Duke Health was not access tier. And they, I don't know, within a week had sat down with the health plan, worked it out, and now they're access tier.
Mm-hmm. Some of, the LifePoint are still not.
Yeah, but Duke Health generally.
Yeah.
So why didn't every hospital that says, we didn't even know this was going to happen, why didn't they sit down then and offer to not overcharge so they could still see these state employees who mean so much to them?
You had full opportunity, so.
I think that as a PR hack myself, I think that they knew they could run this PR campaign. And they knew that the sentiment would be with them because they are a trusted. Everyone trusts their hospital, right? I mean,
as opposed to the state health plan, which is the government.
Yeah. So, I mean, I think I wasn't part of the negotiations, but they probably didn't expect this to actually happen. Like, I know that Falwell fought the good fight for many years about the CPP or the Clear Pricing Project, but it never really had any.
No way. They weren't doing
teeth in it. So, I mean, kudos to Thomas and Treasurer Briner for, standing their ground.
I hope it works.
if it don't, we'll be here to yell about it too, right?
Yep.
Well, then they will have to look at something. Listen, if these hospitals think, okay, now we've got the business, and so next year we're going to jack up those prices back to where they were, then you're in a situation where you definitely have to look at more of a situation like Treasurer Falwell threw out there, where you have to set a ceiling.
Yeah.
You just have to set a ceiling on it. And, Montana did that. Their treasurer, Marilyn Bartlett, who's kind of a folk hero in the world of healthcare now, because they don't have near as much access to healthcare in Montana. You got to drive a good distance. But so it took tremendous courage and resolve to hold firm. But their health plan was literally one of those that was going bankrupt. And they went from going bankrupt to, in a 3-year time period, having a good amount of reserves in that health plan to maintain it for those state employees and retirees, only because they stood up to the hospitals and they kept their resolve. And she said they definitely took a pounding from the public. The public didn't understand at first at all. And that's okay. It's not people's job to understand. People are trying to just do their best to go to work,
just trying to
take care of their family, and all they hear is you're taking their health care.
Yeah.
So what are other associations that represent state employees and retirees, or like, what are they saying? Have you heard anything? I haven't heard anything from any other organization. And I know that we've had a lot of teachers on our Facebook complaining about, and, I look at NCAE's website and I don't see anything about it. How are they able to just bypass it? It's such a big deal for our members.
Yeah.
I don't know.
Well, I'm not sure what you would say. If you're them.
I guess what I'm saying is we need some allies, I mean, everyone should be fighting this fight. So
yeah, but it's not fun to fight the hospitals.
That was just an aside.
And quite frankly, there are some organizations and groups who are just focused on how many members they can get, which that's important. There's power in numbers, but SEANC is actually in the fighting for rights and benefits.
Yeah.
And we know that all these things connect.
Yeah.
And if you pay an extraordinary amount too much in one place, it means your folks aren't going to get anything anywhere else. So we're just trying to make as much money stay in your pocket as we can make. And again, you're not going to lose your health care anywhere in this state. You can go. It just won't be as cheap as it will be for somebody whose provider happens to be willing to be access or preferred level. But that's up to your healthcare providers where you live. And in some places, in some places there's not many. In some rural areas, there's not many state employees in some of the pockets. And that's the thing.
So, Artis, you were on the radio on Wednesday, WPTF Afternoon News. I really enjoyed your interview. You said a lot of the same things here on the podcast so far.
Yeah.
But I think that people should go to our Facebook page and listen to that, because you really spelled out, especially the PR campaign that's back in the WakeMed and Atrium side.
Yeah, it just hurts my feelings for people, honestly, because they do trust their hospitals, and because the doctors and nurses and healthcare providers and those that support them do so many extraordinary things for us.
Yeah.
And we want the best for them. But we've lost focus in this country a long time ago. And it's become about marble lobbies and spa-like birthing centers instead of paying our healthcare providers. So it hurts my feelings to see hospitals saying these things like we were shocked to learn.
Yeah.
Okay. Again, if you were shocked, it seems like that shock would have driven you to action if, in fact, these state employees mean so much to you. And if you're all about your community. And, let's just talk about the elephant in the room. WakeMed and Atrium announced on Friday afternoon a few months ago, we're planning to merge, or Atrium to take over WakeMed, however they are doing this. And that the Wake County Board of Commissioners was going to have it on their consent agenda, meaning consent agenda means you don't debate it. It just kind of, it's there, it gets voted on, it's real quick. And this was on a Friday afternoon, that it would happen on a Monday, the next Monday. So one of the Wake County commissioners said, I've gotten a lot of feedback on this, that shoving this through on a consent agenda with all but no announcement to the public is not cool. So let's put this off. They put it off for 90 days. And we're coming up on that. So the question is, does WakeMed and it's $1 billion in reserves, and Atrium, and they're $10 billion in reserves.
Yeah.
Does Atrium still want WakeMed if WakeMed is not access
there a
or
story
preferred?
this week they were maybe reconsidering it or
Right.
something? So.
But literally, that was one of the things that came out. Yeah, it may even affect this merger. Is that supposed to matter to a state employee?
But, if it doesn't happen, then another hospital system will probably take them over, maybe UNC Health, and then maybe UNC Health is not preferred the next time. Maybe they have such a market.
That's the thing you have to watch. I mean, this will be a really bear of a job for the health plan moving forward, is to make sure, because consolidation stinks. It's awful. So whenever any hospital system, I don't care who they are, they start buying up everybody, everything's going to get way more expensive than it should be.
Yeah, always results in
So
increase.
it's going to be hard for them to make sure the folks that become the golden child this year in terms of preferred provider don't decide next year they're jacking it up.
Yeah.
But again, if it gets to that point, that's when everybody has to be ready to demand that what Montana had the guts to do, that we do it. But I do think Treasurer Briner had to try something else first.
Yeah.
And if the hospitals show they can be good faith brokers in this, then fine.
I think that he saw the success of the Lantern plan.
Yeah.
And I think that, like we talked about last week, it's kind of a little bit of an extension of the Lantern program to the entire system.
But remember, Treasurer Briner comes from, he dealt with Wall Street for decades. So if hospitals thought that's a guy that's going to blink.
Yeah.
Yeah.
Oh, there's just so much we could talk about. But, and like Atrium is so big that it can fight this fight, right? I mean,
yes.
Yeah.
They are owned by an even larger behemoth,
and they know
Advocate Health.
And they know that they own hospitals in rural areas where people need them.
Mm-hmm.
And so those people will complain about this. Right?
Well, because the messaging's not clear coming from the hospitals about the fact that people can still go there when they have an emergency. And by the way, if that emergency means that you need to stay at that hospital and be treated,
right,
you're treated for the whole time through without being penalized in any way.
And if that's ever not the case, give us a call and we will fight that for you.
Because Thomas Friedman's been very clear. We want you to go get treatment.
Yeah.
But if you have an elective procedure and you'd prefer to have it to Atrium, I mean, it's my understanding there's Novant facilities in a lot of that area too. So you're going to maybe have to drive a few more miles to a Novant place if you want the cost of your procedure to be significantly lower. So it may be a little more in gas to save a lot more on the procedure, or go to Atrium.
Yeah.
You can still go to them.
Yeah.
You just pay more for it.
Yeah. So let's just wrap it up with some top line facts, as I was mentioning earlier. If you have an emergency, go to your hospital closest to you. The tier system doesn't matter at that point.
Right.
Premiums are increasing 5%, which we are opposed to, but it could be 21% if this tier structure wasn't introduced. Your argument should be with the hospitals that are electing not to help you save money, right?
Yeah. Right.
Anything else that
I had some questions about out-of-state coverage, and you are covered at the access level wherever you live if you're a state employee. I had a spouse of a Medicare-eligible retired state employee. She was retired too, that lives in Florida. So she can see her providers in Florida, use the state health plan here from North Carolina. It's at an access tier rate.
Yeah.
Yeah, that's good to know.
Yeah.
Yeah.
That is good to know.
Mm-hmm.
All right, so the only other news story I had this week was Colin Campbell at the WUNC wrote a story about when the raises and bonuses would be paid out. And we had a lot of comments on that story too, rightfully so. And you spoke to him about this story. You pointed out that it may be political, it may be an attempt to curry favor right before an election.
Just seems convenient.
Yeah. Mm-hmm. Artist Watkins said if it was the raise and you weren't implementing it until October, you would save 1/4's worth of money of the raise. But when it's just the one-time bonus, there's no savings, so there's no reason to withhold.
Yeah. I mean, because a raise is recurring and it's divvied out all year, we have had situations where the legislature delayed the raise. Mm-hmm. And that way they could give a bigger raise because they saved 1/4's worth of money.
Yeah.
But moving forward, you would still have had that amount of raise added to your salary. But with one-time money, there's no savings in waiting.
Yeah. And we're not talking, so the raise part the state controller's office reached out to us and told us they couldn't, I guess, press the buttons in time to make it happen for July, and that's why it's delayed to August. But you're still getting paid the new rate from July 1 on, so your August check will be, not saying much, but it will be larger than a normal check will be. Like the September check may be lower than the August check. But the bonuses are a different story, it seems like.
It is.
Yeah.
So another bit of news out of Scenic World is that we did launch our new website this week, scenic.org. I mean, it's very up-to-date and modern looking. Right now, the overall function of it may be similar to the old website, and that's just because for continuity's sake, but we will be adding more features as time goes on. We do have a login feature to a member portal, which is a big deal for a lot of members who have complained that they had no way to access their accounts and see what they're paying and things like that. I mean, they had to call here to do that. So now they can access all of that online. I feel like we're up to 2000, maybe 10 now.
We're crawling into the...
We were like 1997, and now we're up to like 2010. You can see what you're paying and things. So check it out, scenic.org. First time that you use the login feature, you will have to create an account. If you have any problems, send us an email, webmaster@scenic.org. And I hope you like it. A lot of cool things on there. And we're hoping to release a mobile app in the fall. So built on this website. So
very cool.
Very cool. Check it out. Sammy, what's up with the Gen Zs these days?
So, since we talked a lot about healthcare in the state health plan today, I found some information about Gen Z's approach to healthcare.
Cool.
Starting with some of the priorities of Gen Z when it comes to healthcare are more holistic, and that can be reflected in what they are looking for when it comes to benefits from an employer. The main benefits that they are prioritizing when it comes to looking at employers are retirement savings, mental health services, maternal care, and something a little different that Gen Z is starting to look for when it comes to benefits from employers is childcare services. Because we do want to have families one day, and even just support or some sort of benefits, stipends of making childcare a little bit more affordable is something that Gen Zs are really looking for.
You should be.
Yeah, truly.
Childcare is very expensive.
Always, but it's been that way.
Yeah.
Forever, to where oftentimes one spouse is working just to cover the childcare.
Yeah.
Yeah.
So when it comes to how Gen Zs are consuming healthcare, though, they're consuming more in person than online. They actually, while we do not prefer full in-office work necessarily, Gen Zs are much more likely to prefer hybrid and remote work scenarios. They do prefer in person as a way of communicating with their doctors.
Yeah, I think there's always going to be that. You always want to go to the doctor. What about, does it say anything about like mental health services?
Yes. So when it comes to talking about mental health services, that is more than 63% of Gen Zs are looking for mental health services whenever it comes to one of the benefits that they want from an employer. And some of this includes not just therapy and psychiatric services, but also nutritional services.
Yeah, but it doesn't say whether they prefer in-person or telemed when it comes to mental health.
Not
because I could see that would be something you'd be okay with talking to someone. Over Zoom or something or virtual.
Most people would.
You still want to go in person?
No, I think.
Okay.
Yeah,
I doubt it because we have Teladoc as something we offer here, and people love Teladoc.
Yeah,
and they love it because they can contact somebody anytime they want.
Yeah. A lot of testimonies about how great that program is. You should check that out, by the way, on our new Scenic website.
With this, employers have also been trying to evaluate how to drive healthcare utilization with Gen Zs because a lot of Gen Zs do say that there are things keeping them from going to see a doctor. And based on a study that I found, some of the barriers are nearly 45% say that cost is the thing that is stopping them the most.
That's what we're screaming about.
43% said embarrassment / lack of trust. 40% said time. And 28% said inconvenience. And I feel like we have had discussions before of researching and figuring out where to go for certain medical things, and that can be an issue amongst some. But for Gen Zs, there is only 25% of Gen Zs that say they don't know where to go, and that's the reason that they don't access it. But the main thing is cost.
Yeah.
And affordability. And with that, it also has cost of healthcare, talking about what Gen Zs are willing to pay for when it comes to healthcare. Now, nearly 27% say that they would not pay for primary care. Nearly 26% say that they will not pay for mental health. But the crazy thing is, nearly 31% say that they will not pay for functional medicine.
What is functional medicine?
Basically, whenever it comes to actual care and saying, I need certain prescriptions, certain things like that, they would rather not pay out of pocket for those kinds of things.
I wonder if it's that they won't or that they can't.
Yeah.
I think it is a combination of, because in this, it also says, despite support from family, because a lot of Gen Zs still are on their parents' health care, this generation is already hammered by medical debt, and 25% of Gen Zs have reported skipping rent or mortgage payments because of medical debt obligations.
Wow.
And a major challenge is inadequate insurance. 68% of Gen Zs with insurance said their medical debt was a result of their plan not covering the services that they need or received.
Wow. Well, good, appropriate topic for the Gen Z Minute this week.
Interesting.
It is interesting.
Yeah.
But overall, Gen Z does want to prioritize their health and invest money into it, but they need to be able to access services with clear pricing transparency.
Yeah.
So does everyone.
What they need.
I think a lot of those issues everyone has. Right?
Everybody's done.
Yeah.
Everybody's just done with the system. It's true. I mean, like, people keep saying something needs to be done. Well, yeah. But I mean,
forbid.
Unless the industry can decide it's not going to abuse people the way it has been in terms of cost, I think you'll see in her lifetime for sure. They're going to ditch this model.
Yeah.
Oh, yeah. We are already at the point where Gen Z is basically on their own DIY healthcare system of how they care for their own mental and physical health.
Yeah, that's even scarier.
Yeah.
So I hear what you're saying, artists, and, I would not disagree with socialized medicine. And it's kind of the same thing, I guess. But I would think that before we get to that point, we could heavily regulate.
That's what I'm saying. Unless they're going to not fight that.
Yeah.
I don't know. There doesn't seem to be a middle ground that the big healthcare conglomerates have been willing to reach with people. And the point I'm making is that her generation is going to say, because they're going to be in power at some point, and they're going to say, we're not doing it.
Yeah.
We're just not going to. There's so much about what's been accepted or done by the generations before them that they have absolutely rejected.
Yeah.
So they're going to get there and say, we already can't buy homes.
Yeah.
But we're going to get our colonoscopy.
Yeah.
We're
Gen Z might save us all, yeah.
Well, yeah. I mean, I just don't think they're going to, I don't think they're going to tolerate being the only industrialized nation where we pay this kind of money for our health care.
So before we get to the question of the week, I have something to bring up to you, artists. I sent it to the group chat earlier this week, but someone has taken your state job, the state job that you were born for.
What is
caring for the puffins at the NC Zoo.
I couldn't
Did you see
believe it. I didn't even know we have puffins at our zoo.
I know. So so the NC Zoo has been doing some awesome videos on social media about their keepers and what they do, and it's really cool. I really have enjoyed them. But a state employee named Lauren is in charge of the Rocky Coast area. Or I don't know if she's in charge of it, but that's where she works. And she cares for the polar bears, the seabirds, and the Arctic fox, and other animals. The Arctic fox was pretty cool. Her video.
Lauren is so lucky.
Yeah, so we have to get Lauren on the podcast. Maybe we'll make a trip to the zoo.
I
want to do it. Yes, let's go. I didn't even know they had them.
We could do video podcast that week, and maybe they'd let you pet a puffin. Oh man, Lauren,
you guys can't see Artist's face right now, but
I'd be so
the sheer excitement on her face is fun.
Lauren might have competition for her job. Artist is going to send.
So cute.
They have a new director at the zoo, and he's been doing a lot of videos and things. It's pretty cool.
So a good time for us to.
Yeah.
This, and that just points out the zoo has so much that we just don't even know about. Y'all definitely go to the zoo. John is you are the best advocate for the zoo. You talk about him a lot.
I grew up like 10 minutes from it,
Yeah.
and we went there all the time.
We'll have listeners.
All my friends work there.
Kickbacks.
So all my friends work there, and we snuck in the back gate and went through the zoo.
Oh my gosh, John!
So it was pretty fun. That was 40 years ago. Okay, or 30
You're lucky
years
a
ago.
tiger didn't grab you or something.
I've been through the back gate of the zoo, but it was with the zoo staff.
Yeah,
Well, I was
you don't
too.
know
It
what
was
that
just
gate's
illegal.
leading to.
I was given permission. I was at
Yeah.
a scenic event, and they
Yeah.
said, "Do you want to go through the zoo?"
Oh, and they're opening the Asian exhibit soon because the budget passed,
Finally
right?
got the budget.
So they
I
can
know.
hire people for that.
The zoo staff was
What a
really
treasure
excited
we
about
have.
that.
Yeah, see if the zoo will let us come out.
So
I
we're-
would love it so much.
And then I'll drive y'all back by our pottery shop.
We want to see the
Love it.
pottery shop.
Love it.
He'll make us buy some.
I got in the plug this week.
You did. Listen, I want to say something else about puffins before we leave.
Okay.
I saw this thing and it's so cool. In Iceland, in some town there, where 20% of the world's puffins are born in that town.
Mm-hmm.
And it's kind of like on Bald Head Island, where everybody will lead the sea turtles that are born to the shore so that they don't get
Yeah.
confused by lights of town. And they're drawn to the moon, so you take a flashlight and kind of help them to the sea. Volunteers have to do that. Well, people go to this town in Iceland during this certain 2-week period because these puffins sometimes get confused by lights from town,
Oh.
and they'll fly towards town, and then cats will get them and stuff like that. So volunteers come from all over the world, and they join with the people from that village, and they help the puffins. And here's how they do it, y'all. They take the puffins, they gather them up, and then the next morning, each person has a puffin, and they kind of chunk them off a cliff,
Oh,
like up into the air. And the puffin naturally,
Will fly.
yeah.
I found what that's called, actually. It's called Puffling Patrol.
oh wow.
Can you imagine?
See, and I'm sitting here thinking that puffins don't fly, that they're like penguins.
And so
They definitely fly. They fly
Okay, cool.
speedy.
this says that they rescue the young, disoriented puffins that wander into town during their first flight from the cliffs to the sea.
That's
So maybe
cool.
we should take over Iceland. No, it was Greenland.
No,
wasn't
stop.
Let's go.
John,
Ew.
he's lost it today.
it? Okay, I mean,
But
we could
can you
have all the
imagine
puffins.
being part of the Puffling Patrol.
Nice.
That would be so much fun.
Okay, well, so my question of the week this week.
John's wacky weird question of the week.
And you have an out from this conversation. But what is something in North Carolina, or specifically maybe the Triangle, that maybe is off the radar, but people would have a good time doing? And I say this because people are broke, but they still want to take vacations. It can be North Carolina, and therefore you can say like the zoo. So that can be your out. But I have one that I really want to do. I want to go to Dix Park and see all these birds that are showing up. Have you seen this?
What?
No.
Yeah, on Instagram, there's like crazy birds there, like colorful birds and things. Yeah.
That have just flown in.
It's like a bird watcher's paradise all of a sudden.
Oh, wow. Yeah. And John's the bird watcher.
Yeah, big into birds
That's
because I
super
bought
cool.
Yeah, so Dix Park birds. That's what I want to do. I may do that one day.
I'll plug the mountains.
Okay.
Got something. So the first Hunger Games movie was primarily filmed in North Carolina. And there are 3 different spots in the western North Carolina area that you can go to that are filming locations. So one of them is Henry River Mill Village,
Yeah,
and
I've
that's
seen that
where
one.
District 12 is. The arena was DuPont State Recreational Forest. And some of the additional regional stuff is in like Pisgah National Forest. in
Very cool.
Pisgah.
So, yeah, I think I spoke to a member from out there once who lived close to the Henry, whatever, Mill Town.
Mhm.
Yeah, at convention, I think. And I can't remember who it was, but yeah, I remember that story. But and also the other is the state park.
DuPont State Recreational
So we have
Forest.
state employees there too.
Yes.
So anything cool?
Well, we were talking about the sea turtles just a minute ago, and I know the locals at Topsail Beach don't love the summertime, but you know there's the sea turtle
Mm.
facility down there, and
Yeah.
just this morning I saw where folks are gathered at dawn.
I love
they've
that.
got it roped off so you can watch the sea turtles make their way to the oceans.
We go to Holden Beach and they have a big sea turtle presence
Yeah.
too. They have the same thing. I saw a video of a man who found the sea turtle on the other side of the road,
Oh, wow.
going the other way towards the waterway.
Oh.
And so he like picked him up and took him back to the ocean. It was very sweet.
Turn around.
So yeah, the sea turtles are
Yeah,
a big deal.
that's cool.
What about you,
I would like
Artis?
to do that too.
Yeah.
To me, it's always going to be the Museum of Natural Science. It's just because I think that's amazing that we have that, and that there's so much for the littles.
Yeah.
Or any of us, actually. I still enjoy going through there.
Yeah. It's a neat place.
Suzanne, we used to walk over there
We did.
when we were at the legislature during breaks.
Now, the History Museum is under renovation, right?
Till for another full year, I think.
Okay.
Mhm.
Yeah.
Yeah,
But the Natural Science
and
one,
it needed it.
Yeah, it's open.
is that the one with the dinosaur, the Natural Science one?
The acro.
Okay. Yeah,
I
that's
think we just plugged every part of the state.
Yeah.
We did. We covered it from end to end.
But that museum, and the fact that we have a museum like that is
Mhm.
it's free.
Oh, I saw something about, Sue is the T-Rex in Chicago's
At the Field Museum in
Field
Chicago.
Museum. And you can now smell what her breath would be like.
Oh,
Ew.
Why would
Yeah,
we?
you like press a button and the smell comes out.
okay.
Yeah. So maybe we do that at the North Carolina.
So, fun fact, Sue almost came to
Yeah.
our museum.
Yeah.
Betsy Bennett was a director at the time, and she was really just a super visionary person and very nice and cool person. But Betsy said, let's get Sue. And that's when they were redoing the Science Museum. And she said, that would just be cool to have that as a feature. And everybody's like, yeah, we would never be able to get Sue. We slightly missed that bid to the Field Museum that had so many more resources, but she had marshaled enough support from people who supported the museum that she came real close. But that acro, in many ways, that Acrocanthosaurus that's from Atoka, Oklahoma, is apparently a pretty doggone amazing specimen. It's right
it's
up
pretty
there.
awesome. And it's very similar to a T-Rex, right? It's
Yeah.
So
And while you're visiting the Museum of Natural Sciences, you could cross the street and visit your legislature.
Mm-hmm.
talk about speaking of dinosaurs.
Yeah.
If you,
I don't know, because of what we do. I just personally think everybody should make a trip to the General Assembly and
if they're there,
see
right?
where
I think
it's
more
done.
people need to know that
Yeah.
that's accessible. Because
Yeah.
I have
Even-
so many
even
of
when
my
they're-
friends that are like, oh, no, I need to make an appointment to go in there.
No,
And I'm like,
you
no,
don't.
you can walk straight
to the
into the
public.
building.
I love seeing other states' legislatures as well. I think it's cool to go into them.
Yeah. So are they there when they're not in session, or in LA at least?
In
Assisting?
some offices,
Yeah.
generally it's not fully staffed when they're not in session. But some of the local
There's somebody around.
legislators will go in to do some work. There's somebody around, but
And
it's
if
even an interesting place when they're not in session.
if you're coming to Raleigh, you could probably contact us and we could
Yeah.
maybe check into
Yep.
it. So.
In the Capitol,
Oh, yeah.
another
Capitol,
really,
yep.
it's more interesting to go in the Capitol than you would think.
And the governor has his offices in the Capitol, right? Or is that still a thing? I don't know.
I think he still has some in
Yeah,
there.
I think there is.
Yeah.
I think there is too.
Very cool. So informative episode this week. If you're still listening to us, thanks for sticking around, and we hope you have a great week.